Nigeria's President Muhammadu Buhari is travelling to London on Tuesday for what his office says is a routine medical checkup. Now, according to a statement from the presidential spokesman, Femi Adesina, he's expected to return home in the second week of April. The statement has not given any indication of President Buhari's condition since he's become president nearly 6 years ago. President Buhari has travelled several times to the UK for medical care. The 78-year-old spent more than 3 months abroad in 2017, and there have been growing concerns over the president's health since the presidential election of 2019. His activities and public appearances have not been very frequent. Well, as speculation about President Buhari's health has been doing the rounds for some time now, Omoyele Sowore is a Nigeria-based journalist, and he joins us now via Zoom to share some insights, and he's in Abuja, Nigeria. Omoyele, thanks so much indeed for joining us. Always good to talk to you. The president's health has been a debate topic since even before he became president.
That's right. Yes, it was the best kept secret before the election. The president was sick several times before his election. He came in London because there's too much pressure on him at that time. And as soon as he came into office, he turned the Nigerian state to his medical insurance policy. And he's been going back and forth to London, and there was a time he spent over 4 months, and after that he went. And I think the only reason why he was around for this long was because of COVID-19. Otherwise, he probably would have been to the UK several times. And as soon as COVID seemed to ebb a bit, he jumped on a flight to London as we speak. What is different this time is that Nigerians are so pissed off with him, especially Nigerians abroad, and they're planning all kinds of protests to return him back home so that he can come and do his medical checkup in the hospital he probably has refused to build in the last 6 years to power. Because he made a promise in 2015 when he was running for office that he will criminalize medical tourism. But now he's become the chief medical tourist of Nigeria. I think apart from the former president who died several years ago, Omoyele, this is the sickliest, if there's a word like that, president that Nigeria ever had.
Does anybody know what he's actually ill with?
Well, there was some medical information that was available in those days when he was going out frequently, that he had an operation for cancer. And then after that, Sahara reporters, we found out that he had Crohn's, which made him not, I think his stomach doesn't hold food, and the one that took him away for a long time. And we were reporting consistently in those days, and they said he was fine, he's fine. When he came back, he said it himself that this is the closest he was to death. That was when he came back from that long trip. But ever since then, he's been fairly around, even though there are also other that he has dementia.
All right, we're having a problem with your signal. I just wanted to get that last bit. Did you say dementia?
Yes. Yes, there's credible information that he also has dementia. And that is a well-known secret around here in Abuja, that people have said that sometimes he's just a mannequin. They dress him up, put him on TV, and they get him ready for some of the scripted events. And he cannot do that for a long time. And when it's always with some special select journalists from the state media, they don't allow him to address the media for a period longer than 30 seconds at a time because of this problem of dementia. Yeah, But there are also, I think there are also other physical problems that he's dealing with. But this is hidden from the public, even though he said he would be transparent with Nigerian people when he came to office regarding his health condition, considering that we lost a president to such a high level of secrecy regarding health. That was Buhari Yar'Adua. And even at that time, this president, when he was still a political candidate, had asked Umar Yar'Adua to resign due to his health challenges. Now people are also asking him to resign. And there will be protests if Nigerians in the UK find the hospital where he's going to have this checkup, they will protest in front of the hospital. There's a lot of planning going on to protest against him over his wastage of state resources on his health, which is refused to disclose to Nigerian people. And also his disgraceful conduct as a president who promised to build the health sector and hasn't built even a block of hospital, and hasn't even provided syringes in this state house clinic where they spend billions of naira every year.
And all of this comes just 2 days before doctors are going on strike in Nigeria over pay and working conditions.
Yes, that's the most painful part of it. And I think that's why a lot of people are really pissed off with this latest trip. And, doctors are going on strike. University professors went on strike last year for 9 months. And now doctors are going on indefinite from Monday. So and members of his regime, what we call a cabal here, don't care either.
I've seen some quite startling statistics. A report says there are at least 8,178 medical doctors of Nigerian origin working in the UK alone. And according to data on the UK General Medical Council website, and that's a 50% increase from 2015. So if all the doctors in Nigeria are fleeing, what's left for the Nigerians, 200 million people?
Nothing is left. I must tell you that. And that is why public officials, including the president, don't go to hospitals here, because we don't have hospitals here. We just have death centers and mortuaries. I don't even think there are hospitals here who can genuinely preserve dead bodies for a long time, apart from. So when I was in New York, and I spent 20 years, 3,000 Nigerian doctors in New York State alone. There are 50 states in the US, so you can do your math. Everybody's living, and I usually say about Nigeria, a lot of Nigerians have mentally seceded from Nigeria. They're just trapped here. If they get a chance to leave, there will be nobody left here.
So hence the anger that the president gets to go on this medical tour abroad, best facilities in Europe, and yet Nigerians have to put up with underfunded and substandard healthcare system.
Absolutely, and people are very, very angry about it. We've been angry about this for a long time, and each time a new dispensation comes on board, they tell stories about how they want to fix the medical system, but they find out that they're not interested. They, at the slightest provocation, even with a headache, they leave the country. There are probably more air ambulances in Nigeria than there are standard hospitals.
Wow. Wow. So you, I saw on social media, have called on Nigerians in the UK to occupy the hospitals where Buhari is staying, and also the embassy in London. And I suppose this is what, to force the man to return home so that he can also use the hospitals that you have to use.
That's it. That who was 6 years, promised to build hospitals of
All right. Omoyele Sowore, we're
of his
going to
own
have
medicine.
to...
Let him
Okay.
come back home and do the medical checkup where the
All right. Omoyele, we're going to have to leave it there. We're having troubles with your line, but I think you've got the message across by and large. So we have a situation here where we have a president who has been ill for most of his presidency, and this term in particular, he's hardly ever seen in public. He makes rare public appearances, and there's speculation of the various things that he's ill with, and whilst many Nigerians have to stay at home and deal with underfunded, substandard medical facilities, doctors that are leaving in their droves to go work in countries like the UK, North America, again leaving Nigerian hospitals compromised, the president is able to get on a plane and go and get world-class help across waters, and Nigerians at home have to suffer. And I wouldn't even be surprised if he comes across a Nigerian doctor at his hospital in London.